going to so many seminars, and in seminars what they do is they will usually hand out some home sleep test units. And I knew that I'd snored. My kids obviously point that out. And so I took a home sleep test, and yeah, I had mild sleep apnea. So the doctor can also be the patient. So I had my own oral appliance fabricated, and I want to show you how easy it is. You pop in the top. That's it. Is the appliance comfortable? Yes. It's like wearing, anybody that's ever had a sports guard or anybody that's worn a night guard, it's basically like, or retainers. It's like a little bit thicker version of a retainer. It keeps your mandible in a slightly open and forward position, and it maintains your airway open, and it maintains your airway from collapsing at night over and over, which is how patients that have obstructive sleep apnea, their airway collapses. It's an upper airway respiratory issue. Well, I had this oral appliance fabricated probably about a year and a half to 2 years ago. And I have a secondary one also, so I wear it every night. And with it in, I definitely don't snore, and I wake up and I feel better. So like I said, the doctor can also be the patient. I definitely can empathize with patients when they come in, and especially with the wives. When the wives come in and they tell you that, hey, I can't sleep in the same room as my husband, or today I actually had 2 different husbands come in today that their wives pushed them to come to the office because they snore so loud and the wives didn't want them to be in the same room with them. So these guys end up sleeping in the guest room. So yeah, I can empathize with guys that they snore. But with the oral appliance, one of the great benefits is that you stop snoring. It's a great benefit for the, for the spouse. Well, I opened Snoring and Sleep Solutions because there hadn't been an office in Las Vegas dedicated solely to the treatment of patients with sleep apnea with oral appliances. So there was definitely a need, and I love helping people. And in this location, one of the things that I love is that I get to spend so much quality time with patients versus in a dental practice doing this, you're bouncing around from room to room. You got an exam over here, you got to get somebody numb in the other room. But here I spend at least 30 minutes talking about sleep apnea with patients, talking about the results of their sleep test, going over their pharyngometer and rhinometer results that we do here at the office. So that's one thing that I really enjoy, is being able to spend quality time with my patients.